5.
Okay. Hi, I'm Claudia from Claude Thomas Med Spa, and we have Dr. Rosenberg here that comes in on a pretty much regular basis and does injectables here, and he is amazing, and he's done lots of work on me, so you can see, and he's going to do some Botox, and he's going to introduce himself too and talk a little bit about himself, and so you guys can see how fun this is to have this in your spa.
Hi there, I'm Dr. Rosenberg, Jay Rosenberg, and my surgical practice is at Valley Plastic Surgery Center, which is in West Dundee, Illinois. What we're going to do is put some Botox in, about 35 units of Botox, and we're going to get it in the areas that are most prominent. So I'm going to ask Claudia to scowl at me like she's angry, and I'm going to mark these areas with a marking pen. Now lift up your eyebrows, and we see a bunch of horizontal wrinkle lines. And we're going to mark these. We don't have to hit all of them, but we want to leave some spaces between them so the Botox can migrate a little bit. We want to avoid getting too close to the eyebrow. We don't want to inject under the eyebrow, otherwise the eyebrow will raise up and peak and it won't look natural. Smile for me. We're going to get a few of these crow's feet wrinkle lines at the side here. This is the core gear area, and that's basically where I use Botox mostly. Some people can use Botox a little bit in the chin if they get wrinkled chins, or sometimes a little bit in the upper lip to help avoid some of the vertical lip lines.
Ooh, didn't know that.
So what we're going to do is drop her down a little bit.
I'm just the hand holder.
Aww.
There we
You hold my
go.
hand. It's cute too.
And as long as I have the guidelines of the little dots that I put on, I can inject pretty free without worrying about much. So I am going to give her a little needle shot in most of these dots, concentrating on this corrugator glabella region, which has the number 11 that most people hate. That's the paired vertical wrinkle lines. The reason I say she's going to get 35 units is because when we dilute our Botox, we get 6 syringes out of a box of Botox. And a box of Botox has 100 units in it. And so each syringe has approximately 16 units. That's the one thing people never find out when they go to a doctor about getting Botox, is really how much are they getting. When I get to the side and the crow's feet areas, I don't go straight in, I go parallel to the skin, and because there's some large vessels there that I don't want to hit. So rather than waste a little bit of Botox that we have left over, I'm going to give it to her up at the hairline. And another one right here. Okay. Now, all the bleeding should stop within a matter of 2 minutes. And I'm wiping off the eyebrow pencil, which is much better than a marking pen. A marking pen, the ink doesn't come off very easily. Wasn't too painful, was it, Claudia?
Not at all. It's worth every teeny little pinch.
Botox takes 3 to 5 days to work, so that's effectively flattening out the areas, keeping the wrinkle lines down. And it lasts about 4 months, sometimes 3.5, sometimes 4.5. Depends on the individual. The longer somebody's getting Botox for, the less duration it lasts. I have some patients, my wife being one in particular, who's had Botox for about 10 years now. And so an average injection of her is only going to last about 3 months. But she seems to think the price is right.
I get that.
You don't have to do anything. You don't have to massage after it's in. I'm rubbing a little bit to just distribute it and disperse it evenly, and also to prevent anything from bleeding. But once we're done with this, you just forget about it. In 3 to 5 days, it should be a nice flat forehead, which doesn't wrinkle a lot when you try. You might be able to move it a little bit, but not a lot. And it gives it a very nice natural look.
4 days from now, I'll re-periscope, so if anybody interested in seeing what it looks like after 3 to 4 days, they can see. Ta-da! And I do have a wrinkly forehead. You can see. And I'm very expression. I do lots of expressions, so I'm always like this and all that. So you'll see I can do all those expressions in the future, but not have my wrinkles. Yay!
So the important thing is, it's nice to know that when you look at it when you're done, there's no bruises. Now sometimes bruises will appear, and they take about a week to disappear. But right now, all I can say is we didn't get any. I didn't see any unusual bleeding. It looks good. All done.
Thank you, Dr. Rosenberg.
Back to work. Don't
Yes.
try to get away without working.
He's my favorite. Come on in and see Dr. Rosenberg. He's amazing.